Don't prepare. Okay, God bless you. 唉，好興奮！今朝早收到，周翠珊仲話聽日先嚟攞，話今日好嚟睇下嘅情況。咁啊，好感恩我哋先去咗衞生部見咗呢個區域主管，咁佢俾我哋嘅意見就嚟到呢度。咁亦都好多謝呢度 Post Office 嘅職員同埋海關，佢哋知道咧呢咁大批嘅口罩咧，太原真咧都係捐俾呢度嘅醫院嘅時候咧，佢哋好樂意去幫助我哋。
依家真係成架車都係口罩啊！
Surgical mask. Okay. We donated from Hong Kong and history. Yes, we are working with WEC mission, and in the past 10 years, we worked in New Life College and ECT School in Wuxi. And because we know the first level of teaching hospital, they have APE. That's why we are willing to.
Now we are lucky here. That the cases are not increasing like expected.
By the grace of God. Yeah.
And then at the same time, we do not also have seriously ill patients that we are admitting at the northern sector of the country. And so we only give thanks to God. But one cannot tell when the waves come what happens. So we also wish to say on behalf of the hospital and then the regional director of health services and the people of northern region. And then our staffs in the hospital here, we should say thank you for giving us this offering. Though somebody will say it's small, but it's too big for us.
That's good.
Each pack 50 pieces. There are some 1,500. So yes, because we also need to send.
It's true. Here we render free service to the poor and destitute. We don't take money from them. Whenever they are sick, they walk in here for free medical care. And also we do also deliver free food to them, especially to the mental ill patients on the street. And we have some mentally ill patients here whom we normally give them 3 daily meals, that is breakfast, lunch and supper. And also we do clothe them.
We have some small surgical masks that we use, but it's not much. So during the crisis, we have to stop the clinical aspects because of the nose masks and other equipment that can use to render the service to the poor. Because when you see, because of the corona, you need to have a nose mask to protect yourself, and then hand sanitizers and gloves. But here, because it's a free medical care, we didn't have enough to cater for the patient, so we have to break for some time. But we realized that the diseases is now coming to stay. So we have now come to see that we have to select some few patients so we attend to them. But we were even short of nose masks here. But now that you people have donated some of the nose masks to us, I think it will be very useful for us.
Three-layer one, PPE. All are donated from one church in Hong Kong. Okay, God bless you.
Sorry, thank you.
The top there is. And if you can find it, you could take it.
The masks are consumables, so as much as they give us, we also use it and we dispose them off. So we cannot have them enough. So we need philanthropists like you people to also come and support facilities, so that government will also be supported in that way to ensure that we have PPE that will protect our people.
It's my fears is just that I don't want to get that due to lack of distance. Sometimes I keep running away to hospitals or go to where people are there, because I don't want to get that much. And I can't detect whether one is happening or not, because the disease is very distinct. It goes all over the world.
Yes, it's very, very good. Because as patients come here, we interact with them as checking of their vital, the BP, their temperatures.
Because it is a big problem. Not a big problem.
That's the need of Ghana. Yeah.
We realize that here the education hasn't gone very well with the people. We've seen that in town. A lot of people don't wear. And when you go to the markets, you see crowds. They're not wearing the nose mask. And it's very important because people come in here. We see people walking here, and at times you ask somebody at the entrance, please wear a mask. Say, I don't have. I can't buy. I don't have money to buy. You see, so it means when we even have enough, we can give them when they are coming in. Patients are coming in because it's not only staff. Because staff are open to so many risks. You understand?
Yeah, there are some people. Most of the people who come here have got NHIF insurance. So they don't have any challenge in terms of accessing the services. But there are a few of them who come without, they have insurance. So those ones, most of the time they are individuals who are ready to put their bill for them, the staff. But where it is beyond the level of the staff, they have got the social welfare. So we refer them to the social welfare and they also take that matter up. They're going to take it upon themselves and seek for support to to ensure that they get the necessary services. So we don't turn anybody away from the hospital because the person cannot afford.
Solutions they have to it's not that hard
Yes. So can you help me to fill the organization? They will suspect us. And then today is...
We are in the center of the town, and being in the center of the town, we are very exposed to the coronavirus. And the very first suspected and confirmed case in Tamale actually happened in our hospital.
And this will go a long way in the process of protecting our health workers from getting infected with COVID-19. And we pray that God will bless our donors for this special donation.